one of the ways that we approach ERP with people who might have a more of a cognitive aspect is I develop something called index card therapy, whereas I'll have a patient take a thought. Let's say they might have a inappropriate sexual thought about a loved one.
Right.
And, rather than a person acting in accordance with that thought, which would never be recommended, we might have a patient take the brain's content, the cognitive content, and write it down verbatim on an index card.
Right.
And then we also put in the component of the association where the brain seeks the relief. And this is also, I think, a very important part of ERP in demonstrating just how irrelevant the brain signal is. So my brain might say, I should only change diapers when I'm in the company of a chaperone, because that's the only way that I can be really sure and safe that my child is not in danger. And so I would also put that on the index cards, and then taking that index card on the person at all times in their pocket and bringing it out 10 times a day to voluntarily activate the brain's association and demonstrating those 10 times a day how irrelevant and meaningless those associations are is a huge way of engaging in ERP and taking the cognitive aspect and turning it actually into a behavioral exposure by reading the card voluntarily.
Gotcha.
Any kind of thought that your brain wants to warn you about, we can use as an exposure.
Exactly.